Preventive measures to be considered for RCCE activities. Following measures can be taken to control the spread of disease. Avoid contact with infected animals. I avoid contact with infected animals, particularly rodents and primates. Avoid handling or consuming raw/not properly cooked bushmeat. 2. Individuals who handle infected animals/animal samples/animal byproducts either in field or in laboratories should follow appropriate biosafety measures to avoid/minimize the exposure. 3. Strict compliance to standard operating procedures for use of appropriate personal protective equipment, sanitization, environmental cleaning, and proper waste management and disposal are essential to minimize the chance of acquiring infection. Personal hygiene. Practicing good personal hygiene, such as regular hand washing/sanitization, is essential in preventing the spread of the virus. 2. It is also important to avoid sharing personal items of infected/suspected individuals such as towels, clothing, razors, etc. Avoid contact with infected person. Infected individuals presented with signs/symptoms like rash, skin lesions, etc. should be isolated for 21 days. 2. Contacts who do not have such symptoms are advised to observe themselves for 21 days after exposure. In case someone develops said signs and symptoms, should immediately report to the healthcare provider. Healthcare staff involved in surveillance and case management should use proper personal protective equipment, PPE, which includes masks, gloves, gowns and head caps. Vaccination. Vaccination is the most effective way to prevent Mpox infection. The smallpox vaccine provides immunity against Mpox as well. People who have not received the smallpox vaccine are more susceptible to the virus. If vaccination is to be administered, it must be given during first 4 days of exposure before the onset of symptoms. Public awareness. Being a re-emerging disease and its prevention, treatment, and control measures are well known, so it is important to spread its awareness among communities in routine health education activities. Educating the public about the risks of Mpox transmission and preventive measures can help to prevent the spread of the virus. This includes promoting safe food handling practices, compliance of personal hygiene practices, and encouraging individuals to seek medical attention if they experience symptoms. Focus of awareness. Isolation of infected persons with signs and symptoms in a separate room or dedicated space of healthcare facility. Patients will be evaluated clinically by the physician, and home isolation may be advised by the physician accordingly. 3. If any house has an active patient of Mpox, they should use a separate bathroom, or cleaning after each use. They should clean and disinfect frequently touched surfaces with soap, water, and alcohol-based or sodium hypochlorite solution, etc. As mentioned in IPC guidelines, they should use separate utensils, objects, electronics, or clean well with soap and water/disinfectant before sharing. Not to share towels, bedding, razors, combs, or clothes of infected and active case of Mpox v. If any house has an active patient of Mpox, they should do their own laundry, lift bedding, clothes, and towels carefully without shaking them, put materials in a plastic bag before carrying it to the washing machine and wash them with hot water 60 degrees Celsius. It is recommended to use disposable utensils and crockery and properly dispose after use. 6. Encouraging everyone in the house to clean their hands regularly with soap and water or an alcohol-based hand sanitizer.